पडगुण बस ठीक देखा Okay, let's start. Mr. Ahmed, a 55-year-old man presented option 2 administered nitroglycerin, option C perform ECG, or option D perform chest X-ray.
Any comment from the other groups? Any क्योंकि सवाल सुना आप लोगों ने इनका या आप अपनी टेंशन में है कि अभी हमने भी जाकर रिजल्ट करना है ना? क्वेश्चन इनका ये है, इन्होंने दी हुई है 55-year-old पेशेंट की हिस्ट्री के वो चेस्ट पेन के साथ है जो रेडिएट कर रहा है, हिस्ट्री में भी है मायोकार्डियल इन्फेक्शन और इसके अलावा उसका पुअर लाइफस्टाइल है। तो आप पहला क्वेश्चन ये व्हाट इज द पॉसिबल डायग्नोज, सेकेंडली व्हाट इज द पॉसिबल रिस्क फैक्टर एंड द थर्ड क्वेश्चन इज व्हाट इज द इमीडिएट मैनेजमेंट। और बाय द वे आपका सब्जेक्ट क्या है? नहीं, हार्ट में अंदर उसकी कैटेगरी क्या थी? तो ये कैटेगरी आपने सेट की थी स्टार्टिंग में तो इस चीज़ को भी आप क्योंकि अंडर कैटेगरी क्योंकि आप हमारे जो एग्जाम्स होते हैं वो इसी तरह के पैथोफिजियोलॉजी का इलाका एक सब्जेक्ट है, फार्मा का इलाका है, मेडिकल सर्जरी का इलाका है, वगैरह हम पेपर भी उसके हिसाब से बनाते हैं। यस
आई थिंक ये जो नीचे स्टेम ये एक दूसरे से लिंक है। जैसा कि अगर फर्स्ट किसी ने करेक्ट आंसर नहीं किया स्टूडेंट ने तो नीचे दो ऑप्शन है वो सारे तो ये लिंक कर रहे हैं दूसरे के साथ। ऐसे सीक्वेंस से हमें नहीं देखना चाहिए। तो ये आई रिकमेंड कम से कम ऐसे कि डायग्नोज तो आप नहीं निकाल सकते। अगर आपने डायग्नोज एक स्टूडेंट ने अगर गलत डायग्नोज निकाला तो फिर नीचे जो दो ऑप्शन हैं वो भी स्टूडेंट उसके अकॉर्डिंगली अगर वो करेक्ट है तो
मैं बिल्कुल आपका पॉइंट समझ रही हूँ। डेफिनेटली आप ये कहना चाह रहे हैं कि पहले में डायग्नोज गलत मार्क की तो अगले दोनों में गलत हो गया। लेकिन आप इसकी जगह पे क्या प्रपोज कर रहे हैं, क्या हो सकता है? कोई आइडिया है? एनी अदर कमेंट?
अभी आंसर जो है ना बिल्कुल मैचिंग नहीं होनी चाहिए, थोड़े से डिफरेंट होने चाहिए क्योंकि स्टूडेंट के लिए सिलेक्ट करना फिर डिफिकल्ट होता है क्योंकि इसमें से कौन सा जो चॉइस है वो करेक्ट है।
किस वाला क्वेश्चन आपको लगा मैचिंग है?
मैम ये फर्स्ट वाला
चाइना का क्लोज एक्यूट एरोटिक डिसेक्शन पेरिकार्डाइटिस एंड एक्यूट पल्मोनरी एडिमा। Any other comment? Yes.
मैं फिर क्वेश्चन ये कि चलती है उसमें हम मैनेजमेंट के क्वेश्चन
Very right. Thank you so much for pointing out this. That is why I asked about it. What is your further area? Of course, you had this cardiac, but within the cardiac, you choose the pathophysiology. So this immediate management not comes under the pathology. Okay? That should come under the medical surgical or maybe the pharmacological. Anyone from this group has this? Okay, you can ask the lab values or maybe the diagnostic procedure for this patient. Yes, Naman?
Your lifestyle is a very poor lifestyle. And second is aortic dissection is a diagnosis. Aortic dissection. It is a procedure which is not a diagnosis.
Thank you so much for pointing out this thing. And when we are writing about the distractors, so distractors should be from the similar category. For example, if you are writing about the diagnostic procedures, so all four options should be the diagnostic procedures. All four options should be the surgical procedures. all 4 options should be the medical diagnosis. So the student would not easily pick the answers. Okay? And the second thing is about the spelling right. If the student will wrongly attempt the first question, so definitely he will attempt the second and third question accordingly. So in case clusters, we need to be very much critical in this sense that if question 1 is wrong, so it should not impact the other question. Okay? Your question should not be linked with each other. These 3 questions should be independent questions. They should link with this scenario, not with the previous question. Is it clear? Each question should link with the scenario. The second question should link with the scenario. Then first link with the scenario. But third should not link with the second or the first. Am I clear? Because in this way, all the questions will be wrong. Or all the questions would be right. In both sides. Okay? So, for developing this, your scenario should be enriched in this sense that you can, for example, if I can add in this, or one of the recommendation is, instead of asking this possible diagnose, I can add the lab values here. For example, CKMB is this, creatine kinase is this, top I is this. So in this way, after writing this, in the next here I can ask, these labs has been performed. Now, what further tests you need for taking the diagnosis? Are you getting my point? And in the next question, I can ask that in which time period the patient crop I can be normalized, or patient CKMB can be normalized, or whatever the testing is. Okay? And then later on question, I can ask about it. What sort of radiological or maybe other tests you can perform. For example, echo, ECG, or angiography, or anything else. So in this way, you can link it out. So automatically, this would be removed, and this is very simple and easily predictable questions. In the similar manner which I had already given in the previous question, that here you are giving this pain that is radiating and patient is having myocardial infarction. So definitely here I will not choose this pericarditis. I will not choose edema, pulmonary edema, because I know patient is having a myocardial infarction. So definitely student easily pick vena pectoris. So this question can be easily replaced with the lab values performed. For example, if you have given this lab value CTMB is this, so next question you can ask what other lab findings or blood testing you can do for this patient. Is it clear? Okay. Any comment? Yes.
In question 2, can it be helpful to add an option all of the above?
All of the above, none of the above, except this one we are not using. These are very poor kind of questioning that is giving a linkage to the student, and student will not read any option if you will have all of above or none of above, because that is giving a clue to the student that yes, all of the above is the answer. So there is no use for putting any other distractors. Okay? So that are very poor kind of questioning. That's why it's eliminated. And now currently in our nursing practice and education practice, we are not using all of above, none of above, any other, or least important. Least important we are using in some extent, but we are trying to avoid these kind of questions. Yes, not both A and B or C and D. No. This could be used in academic writing in comprehension, where the comprehension is much tricky. There you can use, but not in any other subject. Okay, thank you so much. Second group, clap for the group 1, please. Yes. Who will be the next? Okay. Now this time Tabassum will not present. Anyone else? एंड इसी तरह हम दोनों ग्रुप्स में भी जो पहले वाले प्रेजेंटर थे वो नहीं आएंगे, कोई और आएगा। हम सबकी एक्सरसाइज करवाए ना। कोई बात नहीं, सलमान को अगली बारी में बुला लेंगे, लेकिन एक की रहती है। ओके।
Scenario, a 70-year-old male patient admitted in medicine ward. Okay, with chronic kidney disease, as electrolytes are sodium as 120, potassium 6.5, and output is 0.3 ml per kg per hour. And last 24 hour intake is restricted to 1 liter over 24 hours. Blood pressure is 170 by 100. Doctor recommended dialysis. He is anxious about dialysis. तो ये एक पूरा सिनेरियो है हमारे जो कि इससे हमने 3 क्वेश्चन दिए। फर्स्ट है व्हाट इज द रिकमेंडेड डाइट फॉर हिम फॉर द पेशेंट। नंबर फर्स्ट ऑप्शन है सोडियम, लो सोडियम एंड लो पोटासियम, लो फैट एंड लो प्रोटीन डाइट, हाई पोटासियम एंड हाई सोडियम डाइट एंड हाई प्रोटीन एंड हाई सोडियम डाइट। सेकंड है which one medicine is most effective to manage high blood pressure, and this is the question. Vasodilator, diuretics, AC inhibitor, and calcium channel blockers. Third, what will be the predictable nursing approach for caring him? Explaining the procedure, diet, counseling, giving medicine, and vital sign monitoring.
Okay, any comment from other groups? This question is related to medical surgical, and the scenario is about chronic kidney disease. There they have given the lab value and the vital sign, blood pressure especially, and output as well. And first they are asking the recommended diet. Secondly, they are asking about the medicine, and third one they are asking about the preferable nursing approach. So who will comment now? All questions are easy to do. Could you explain it more?
Yes, related to the scenario, but explicit to each other because every person is not related to the other. One is asking about the diet, second is medicine, and third is nursing care.
Okay.
So they are not related.
Good.
Good or not?
It's a positive rating.
Okay. Any other? आप कुछ कर सकते हैं? आपके सवाल पे ये चुप हो गए हैं। अभी इनको पता है आप ही क्रिटिक करेंगे इसलिए वो नहीं आपको कुछ करेंगे। Okay. Their concern is in kidney, but under that they are doing the medical surgical. So if they are doing the medical surgical, so here the most effective medicine पूछने के बजाय इस मेडिसिन की नर्सिंग केयर पूछनी चाहिए थी, ठीक है? Because this is related to pharmacology, not the medical surgical. Okay? Our subjects are very much interlinked with each other. So sometimes we could not be able to differentiate it. But if we look at it critically, so there is a difference. So here you can ask about what is the what nursing consideration you can do for, and you can list any of this drug, maybe diuretics or maybe AC inhibitor, and you can ask about it. Okay? And of course, these all questions are independent, they are not linked with each other, but they are linking with the scenario, so this is the good point. And secondly, one point which I would say here if you are asking the preferable nursing approach, so this word is tricky in this sense because actually you want to ask what you want to teach to your patient. Actually the intention is this, that you will teach for the diet, or you will teach for the, you will explain the procedure, or for the medicine, or for the vital sign monitoring. So you can use the appropriate word. For example, if you want to ask the intervention, so put intervention word there. Or if you want, so that all should be intervention. So this point will be removed from there. This is totally a separate area. This is not one intervention. Okay? So here you can write about any other intervention. Yes. Okay? Because this is very much, sometimes we are giving explanation to the patient about the disease process or the medication. So that's not a formal teaching, or that is not a counseling. That is just providing the information. So we can count that in our intervention. But this counseling is totally a separate thing. Okay? And one more thing is here, this distractor is longer as compared to other. So we can cut down some of the word and keep it more concise. Other is okay. Thank you so much. Third group.
This question is related to basically the anatomy. The scenario is 65 years old male patient admitted to the medical unit. Anatomy of brain. Admitted to the medical unit with diagnosis of cerebrovascular accident. He has high blood pressure. Patient blood pressure is 190/40, and the regular blood sugar level is 350. On assessment, nurse noted the patient is unable to move his right arm and leg, unable to talk, confused and disoriented. He also has right-sided facial palsy. This is the scenario. And scan one is which part of the brain is affected in this patient. These are the four answers. The second scan is the patient has facial palsy, which cranial nerve is affected. The third one, which cranial nerve is responsible for the speech.
Okay, any comment from the group?
I think ब्रेन से कुछ बहुत स्पेसिफिक जगह हमने लिए हैं एरिया ऑफ स्टडी और उसको मोर कंसाइज करके हमने उससे बहुत सारे यूज तो एक डीप किसी ने अगर स्टडी की हो तो वो जाके उसको हल कर सकते हैं किसी के पास डीप स्टडी नहीं है किसी स्टूडेंट के पास तो
Anyone else? No idea from this group? आपकी टर्न आने तक ये तीनों तो वैसे भी फारिग हो गए हैं, इन्होंने तो देने ही है कमेंट्स अपने। अभी आपके पास चांस है, आप बोल लें। नहीं, ये तो देंगे, ये अपना कर चुके हैं, ये इन्होंने तो देना ही है।
ये रीजन नहीं है।
ओके, क्वेश्चन में आप लिख रहे हैं कि पेशेंट इज हैविंग अ सेरिब्रल वैस्कुलर एक्सीडेंट, सीरियस हुआ, बट there is not mention about the, okay, there is facial palsy, because in the second question this is most relevant to the facial palsy. So that's why I am pointing out this, because these are the two different diagnoses in one question. Are you getting my point? You can ask here only the CDA and 3 questions related to CDA. And then you can create another scenario for facial palsy and you can develop 3 questions with the facial palsy as well.
we have to do a decision here, which is the condition of the facts related to this.
Okay. So this is recall level questioning, so I don't think so there is any other no linkage, they all are linked. But when you are saying this third question, which cranial nerve is responsible for speech? And another one you is asking about the facial palsy, which cranial nerve is affected. So the question for the both is same. Because in both of these you are asking about the cranial nerve. Is it? But remaining is okay. Because this is just an anatomy and physiology, so the questioning are only the recall level. So thank you. Next one.
हमने जो ओरल लिए हैं वो है लीवर और पैथोफिजियोलॉजी कोर्स पे होगा था। 50 years old woman admitted in a medical ward with chronic liver disease with which is the most important assessment for our client. इसमें ऑप्शंस हैं कौन सी असेसमेंट्स कर सकते हैं, लैब इन्वेस्टिगेशन, फिजिकल एग्जामिनेशन और हिस्ट्री, which is the most important assessment examination for the patient. Second one, what are the causes of this disease? Hepatitis, smoking, imbalanced nutrition, and inadequate food. Third question है, how we will manage the client with encephalopathy? Prevent from constipation, education about nutrition, think about social activities and improve their protein.
Any comment from the groups? Yes, you can.
सेनेरियो नहीं लगा
Very right.
क्योंकि नीचे जो हमारे पास स्ट्रेंथ है, हाँ, उसको वो स्ट्रेंथ नीचे हमें स्ट्रेंथ एक्सप्लेन करना पड़ेगा। और दूसरी जो विथ यहाँ लिखा हुआ है ई ऊपर जो
Yes.
है, तो ये हम
This is not a professional language where you can use this kind of application all the time. You need to write it properly, complete word. Okay. चलिए आप write it down. Okay. Any other comment?
Well, in the last question, they have mentioned about encephalopathy, but encephalopathy has many types. If they could mention there the cardiac encephalopathy, then it could be the right question here.
And in scenario, there is not even a single thing is mentioned about encephalopathy. Being an educator, we know that this liver disease is leading, but for the student, maybe they are not very much tricky or if they are not very well prepared, so that would be very difficult. So something should be added related to encephalopathy in the scenario. Okay? Anyone else? So the feedback you had get from this group and from that group as well is very appropriate. In addition to that, I could add, in first question you are asking about the assessment for a client. But if we are talking about this structure, so first one is lab investigation, second is physical examination, and third is history taking. So these all three are totally different from each other. If you are talking about the assessment, so you need to add the 4 options related to the physical examination only. physical examination of the abdomen, of the liver, any sign or any particular test for the abdomen that you can use. And we know about in health assessment. We had studied many kind of assessment technique or the points related to the assessment. So in the next question, you can ask about the lab investigation and add 4 points. For example, 4 lab values of LFTs, okay, or 4 lab values of different electrolytes, because the patient is having this liver disease. So there could be many problems. And other questions you can ask about the history taking, because in liver there is a huge history of the patient as well, because it is accumulating the different body organs, it is affecting all over the body. So these 3 options is having its own questions further. Am I clear to you? So the distractors are totally functional to each other, because the student can easily take one of the option and he will not think about it. Okay? Have you an idea about the non-functional distractor? Yes, not related to the question. For example, if there are 4 options and 3 are related to the diagnostic procedure and 1 is related to the treatment, so being a student, I will not see the 4th option. Because in question you had asked about the lab value. So I will pick only the 3 and I will think around that 3 options. So the 4th one is automatically eliminated. So there is no use of that 4th one. Are you getting my point? That is known as non-functional distractor. So being a teacher, we need to consider that our question should not have any non-functional distractors. Okay? Is it clear? So thank you. That's all. Okay. What this picture shows to you? What is this? What these babies are asking to you? Any idea? Pick one. Lot of choices. So it's mean we are not talking about the standalone now. We are not talking about only single best answer. We are not talking about that maybe there is one true or one false. We are saying just like multiple true false, there are multiple options that could be an answer of that question. Okay? So that is known as extended matching questions. So next please. So for that we need to see our toss or blueprint, which we already developed. That for example I had that I will ask 5 questions from liver, 5 questions from pulmonology, 5 questions from cardiology. So that is my task that I had already divided that how much questioning I will take from that particular unit. Okay? Then I will write a scenario, the case, the strength, as we have in standalone, as we have in case clusters. Is it clear? After that we had lead instant, the question actual that we have in, that is similar in standalone, that is similar in case clusters. Okay? Then in next step we need to develop 10 to 15 homogeneous option, and this is a differentiation point between standalone, between case clusters and EMK. अभी तक ऊपर वाले जो 3 थे वो हम स्टैंडअलोन में भी ऐसे ही करते हैं, टॉस में से देख के हम बना लेते हैं सवाल और उसके लिए सिनेरियो भी बनाते हैं और लीड इन भी बनाते हैं. केस क्लस्टर में भी हम यही कर रहे हैं. But the differentiation point in extended matching that we have 10 to 15 homogeneous options. But in standalone we have only 4. हर सवाल के साथ हम 4 डिस्ट्रक्टर बनाते हैं. इसी तरह केस क्लस्टर में भी हम हर सवाल के साथ 4 बनाते हैं. But here 10 to 15 is the homogeneous option we have to develop. Okay? Then there should be 2 to 3 options that must be correct. This is again one of the differentiation point from the single and from the case clusters, that there will be not only one answer, there will be 2 answers, 3 answers, more than 3 answers could be possible. Okay? Then we need to show the validity and discrimination, and we will review the question. But these last 2 options is same for other questions as well. We will check the validity and discrimination for standalone, for the case cluster, for E and Q. And we are reviewing those types of questioning as well. Okay? So the definition at 4th and 5th level, where we are creating 10 to 15 options and we are making 2 to 3 answers of that question. Is it clear? Any question up till now? Okay, next. This is one of the example of E and Q. What is the best specimen? Which is the best specimen to send to the microbiology lab for confirmation of respiratory tract infection? And we have these list of options. You can see. These are how many? 10. These are 10. And in the corner you can see the correct responses. So the correct responses are 3. These are the answer of this question. Is it clear? Okay. So before moving to this, you have to develop one questions related to E and Q. And I think 5 minutes is enough for this development because of there is only one question. Okay, the area is same, your larger domain is same, and now you will develop one E and Q.